So imagine a stranger who slumps to the ground on the way to the bathroom in the middle of the night. The loud thump, the bump of the head against the cold wooden floor, awake, alert, unable to move half her body, or crawl towards the seemingly distant phone. Imagine how she feels when she tries to call out to her child in the other room, but nothing happens. Just a grunting sound. Intense fright without the possibility of flight. As the noose of death dangles, imagine her child walking in at that very moment. The horror in his face colliding with the terror on hers. Now imagine if that child was you. What would you do? I'll show you what two children facing those similar situations did. One, a fourth grade child, and the other, a fifth grade child. One saving the life of an aunt, the other saving the life of a perfect stranger. My aunt had a stroke 2 years ago. She started acting strange and stuttering. I was panicking. I asked her questions. She told me she wasn't feeling quite good, but I didn't understand her because she was talking backwards. I thought fast, and I called 911. She is now safe. She now lives. She is now as healthy as ever. I'm a good hero. The woman was carrying bags. She picked the bags up, but suddenly her left arm fell down. She was trying to pick her arm up, but she couldn't. Her speech was confusion, so I called 911. Now, these children aren't alone. Indeed, all over the United States, young children are performing great acts of heroism, serving as first responders in the chain of recovery for all kinds of acute illnesses, saving their parents, their grandparents, their aunts and uncles, and even strangers. Now, I believe that we should teach 911 as soon as children recognize numbers and what to say. This chart shows the initial reaction of a few hundred stroke patients and witnesses to acute stroke symptoms. This was in France, but it mirrors exactly what happens here in the United States. I should preface by saying stroke is a highly treatable condition. Time truly is brain. Indeed, every minute a stroke is allowed to continue, about 1.9 million neurons die, along with 7.5 million miles of myelinated axons. So it really is a highly treatable condition. We know that EMS arrival is one of the most important factors in early hospital arrival. Not only that, but the ambulance can divert patients to stroke-capable hospitals, stroke centers, certified by states and by JCHO. We know that ambulances can call ahead to the receiving hospital and notify them of the stroke patient's imminent arrival, thereby giving that hospital the opportunity to prepare and rev up the entire system for the patient's arrival. However, only 19% of individuals in this group called 911. If you add those who call the fire department, that goes up to about just over a third of patients. What did the others do? Some stayed at home, some called their physician, some found other ways to get to the hospital, and some tried to call for an appointment with their PMD. What is interesting is that patients in whom stroke symptoms were recognized by a witness or a bystander were twice as likely to call 911 than patients themselves. So in 2005, I partnered with the National Stroke Association to create Hip Hop Stroke. This program is a multimedia musical program that uses hip hop music and targets 4th through 6th grade children living in low-income communities where stroke risk is the highest. We teach these children the sudden nature of stroke symptoms using acronyms, mnemonics. We teach them the necessity and the sheer importance of calling 911. We utilize these children as conduits into the home to teach their parents and grandparents. And then we empower these children with the skills required to actually call 911 in the event of a stroke. We talk about the time-dependent treatability of stroke and teach them about TPA, the clot-busting medication that has been approved by the FDA since 1997. So I'll now share some of that curriculum with you.
What's up, y'all, ladies and gentlemen? My name is Doug E. Fresh, and I'm here with the hip-hop doc, Harlem Hospital. Let's go! Let's go! Stroke, stroke, stroke. If he don't sound right, then he's doing the stroke. Sway when he walks, then he's doing the stroke. Slur when he's talk, then he's doing the stroke. Call 911, cause it ain't no joke. Now S for the face, and A for the arms. S is for the speech, and T is for the time. Time to do what? Call 911. Time to do what? Call 911. Fact, to be exact. This is not fiction, this is all fact. Kids from the front and kids from the back. This is what we call the brain attack. Now when I say brain, you say attack. Brain attack. Brain attack.
So 80% of strokes are of the ischemic variety, and that is when a blood clot occludes a blood vessel, leading to compromise of perfusion of the brain that's distal to that artery. Only 3 to 5% of stroke patients actually receive this medication. And unfortunately, the reason is because they just don't arrive within that 4.5-hour time window required for administration of this therapy. Now, for those arriving too late for this medicine, this could happen. This is the blood clot within the middle cerebral artery in the brain, that bright linear streak, and this is a CAT scan of a real patient. And this is what happened. This large, dark area of the brain is the stroke in evolution, compressing the brain, the right brain against the left, swelling occurring, and ultimately this patient can herniate and die. Now, the urgency of this is so important that I decided to adopt the hip-hop doc persona and try to educate children about what their role could potentially be in the chain of stroke recovery. So I'll share a little cameo that I made with you.
What up, kids? This is a hip-hop doc reminding you that doing the stroke, it ain't no joke. When Mr. Gibson had a stroke, you saw the neighborhood kids call 911 and save his life. It allowed me to give him the clot buster just in time. Cause as Dougie says, doing the stroke, it ain't no joke, no joke, no.
So we also use video games to reinforce our message, and I'll show you just one of our video games. It's called the Clot Buster Stroke Game. So the ammunition is the Clot Buster medicine. And all the answers are in the song to the questions you're about to see. So in order to reload, the kids got to answer some questions. So they get really frustrated with this part. And when they get it wrong, we tell them the answer. But they can't reload until they get the answer. And so this kid did pretty well, and he got a little bit more clotbuster medicine, and he can continue. So we also use comic books. We take our song lyrics and we create storyboards, and we put them in comic books. And at the back of the comic book, we have interactive exercises that we give out as homework to these children that they use to engage their parents and grandparents at home. Now, tissue plasminogen activator, or TPA, is not a magic bullet. In fact, about 1 in 8, that's the dark gentlemen here, are those who either completely recover or nearly recover. And the lighter green gentlemen are those who benefit significantly. So about 13 in 100, or 1 in 8 patients will be normal or near normal as a result of this medication. About a third actually do meaningfully better. But time is really critical, because the best outcomes are seen in the first 90 minutes. And this has been borne out by pooled analysis of all the major stroke trials. And as you go out to the outer limit, which is the 4.5-hour window, you can see that the number to treat for meaningful benefit declines the further out you go. Beyond 4.5 hours, you can actually harm the patient by giving this medication due to some of the hemorrhagic complications associated with tissue plasminogen activator. So we hypothesize that music can soften resistant minds. You know, after all, music can teach us how to feel. It can create a soundtrack to a mental movie, enabling retrieval of prior experiences with astonishing detail. So we decided to bet on rap music. We decided that we will utilize this music genre to achieve our communication goals with regards to stroke symptom knowledge and activation of the emergency medical system. So this is one of the papers we published showing the results of our intervention. This is just a 3-hour exposure of our multimedia musical curriculum to 4th through 6th grade children, several hundred of them. And you can see here, the black bar is baseline, the gray bar is immediately after the intervention, and the stripe bar is 15 months later. So we had an unannounced survey of testing of these kids at 15 months. If you look across all the cardinal stroke symptoms, these young children did retain this knowledge significantly even after 15 months. The only symptom that dropped significantly was sudden headache. Calling 911 was impressive. We give these children hypothetical scenarios with different options, with real scenarios of stroke cases actually happening, and they chose to pick the best response. And a lot of these children did significantly well to these questions. And I tell you that 80% of the public can't even name 2 stroke symptoms, let alone 4th grade children naming all 5 stroke symptoms and knowing what to do. So we also build in what we call a child-mediated health communication into our model, whereby we use these children, as I mentioned, to educate their parents and grandparents. And as you can see here, this is baseline evaluation testing of their parents before we intervene on their children. And this is testing of their parents after we intervene on their children. And you can see, these were all highly significant, except for slurred speech, which actually had a very high baseline to start with. When we looked at a composite score, about 4% of our parents, we had several hundred parents, actually knew the 5 cardinal symptoms of stroke and what to do. And following intervening on their children, this went up to about 30%, without us ever intervening on the parents directly. So we think this is and we have a randomized controlled trial looking at this more robustly, but we believe that this is a potential mechanism for health communication to adult residents and older residents within these low-income communities. So now I'm going to teach you guys the symptoms, the meaning of the BFAST symptoms, so that you will also leave here with some knowledge of stroke. And I will put on my hip-hop stroke persona once again, and I will teach you these symptoms.
B for balance, E for eyes, F for face, it don't matter what side. A for arm, S for speech, T for time. 911. Teach. B for balance, E for eyes, F for face, it don't matter what side. A for arm, S for speech, T for time.